Hello, my name is Nicholas Merritt, and I'm a nationally certified athletic trainer licensed in the state of Indiana. I'm currently enrolled in the Doctorate of Athletic Training program at Indiana State University. Today, I'm going to speak about fracture of the scaphoid bone in the wrist. But first, I want to give a little bit of background about athletic training and why the information I'm going to provide to you today can be helpful. Athletic trainers, or ATs, are healthcare professionals who work together with doctors to help individuals involved in sports or other activities if they sustain an injury. The services provided by ATs include prevention, emergency care, diagnosing an injury, treatment, and rehabilitation of injuries and other medical conditions. ATs have a large knowledge base to identify, treat, and refer out for a wide variety of injuries. The profession of athletic training can be well trusted within the healthcare system to provide optimal care to any individual. This video is for educational purposes only, so if you think that you have the injury that I'm describing, you should seek immediate medical attention. There are 8 bones in the wrist. These bones are called carpal bones. Starting from the thumb side, when we're looking at it from the palm, we can call them based on their original names. The scaphoid starts first, and then the lunate, triquetrum, and pisiform. On the second row, starting on the thumb side, we have the trapezium, trapezoid, capitate, and hamate. The most commonly fractured bone is the scaphoid bone, the first bone that we talked about, directly below the thumb. This injury is usually caused by falling on an outstretched hand, which we call the Fuchs mechanism. The scaphoid fracture is often mistaken for a normal wrist sprain, which occurs with the same mechanism. This injury is normally due to a stretching of a tissue or a ligament in the wrist. If the scaphoid bone is not put into a cast or a splint, then the bone could die due to lack of blood flow. This is called Preissner's disease. It's important to identify the difference between a wrist sprain and a scaphoid fracture. The signs and symptoms of recent scaphoid bone fracture include swelling in the area of the wrist bone and severe tenderness in the pocket between the tendons of the thumb. This area, between the tendons of the thumb, is called the anatomical snuff box. The scaphoid bone can be touched over the skin at this point. Scaphoid fractures can also be identified if the individual has pain over the thumb or when the thumb is pushed up towards the wrist, or if a direct load is placed on the thumb towards the hand. If there isn't any pain in the snuff box area, then you can probably determine that there is no fracture at the scaphoid bone area, but there may be a wrist sprain. I've had a patient complain of severe aching in the wrist with activity and being unable to grip or lift objects. Other similar activities could also cause pain. If these signs and symptoms are present, cold should be applied to the area using an ice pack or a bag of ice. A splint should be used above and below the wrist joint, and then the individual should be referred to a physician for an x-ray. If the fracture passes completely through the scaphoid bone, then the physician will likely insert a pin and/or screws. To make the healing more likely in this area, the screws will apply more direct pressure between the two severed areas of the bone to help healing and assist with normal function. Otherwise, the fracture may take more time to heal and the bone may die. In other cases, an individual will stay in a cast for up to 6 weeks, and after the 6-week period, the individual will go through strengthening and rehabilitation exercises and be braced, or protective taping can be used when the individual is completing an activity. The wrist will then need additional protection from impact and loading for approximately 3 months if the casts are removed. The best practice would be to train this individual to land with their arms close to their chest and prevent falling on an outstretched hand. I'll demonstrate here and cause the individual to roll into that position. If you have any questions about this condition or this video, please feel free to contact me at the email below.